today we're going to be talking about the three most important pharmaceutical terms that you need to know and how and why pharmaceutical math doesn't quite work out. So the first thing that we're going to do, so there's three terms. So number one. So the first one is what's called a relative risk. Number two is what's called absolute risk reduction. So a relative risk reduction measures, and I'm reading this, so it measures the proportional reduction in risk between the treated group and the control group. It compares how likely the event is in the treatment group versus the control group. So for example, let's say we've got blood pressure medication and we have 1,000 people. What it means is if in the control group there's 30 of those people will get a stroke. And then in the control group, 15 have a stroke. So because that's half, what that means is there's a 50% relative risk reduction, which when it comes from a marketing standpoint of things, from the pharmaceutical companies, sounds fantastic, but it doesn't give you the full story. So the number two term that you need to know is absolute risk. So absolute risk is the risk reduction, tells you how much the actual risk of an event is reduced by the treatment in absolute terms. So this is a much more clear version, okay, especially for individuals that are trying to assess the effectiveness of a certain medication. So for example, let's go back to the blood pressure. Okay, so if in the risk in the control group, there's going to say a 3% chance, right? So 30 out of the 1,000. And then in the treatment group, there is, so that'd be 1.5. So, right, so 1.5, 1.5. So what this would mean, that there was 1.5 fewer strokes per 100 people. The numbers boil down to there is a 1.5% reduction in stroke risk on this particular medication. And what both of these numbers come down to, and this is probably the most important number that you need to know is the NNT, the number needed to treat. So the number needed to treat is how many people need to take a medication for a certain amount of time for one person to have a benefit. Let's give you some examples. So let's look at statins. The number needed to treat for statins is 100 people need to take the medication for 5 years for one person to have a reduction in stroke or heart attack. So let's look at blood pressure medications. Okay, the number needed to treat, NNT, for blood pressure medications is 67 people need to take the medication for 5 years for one person to have a reduction in a stroke. And last but not least, and you can look these up for all the different medications, I highly recommend this. It's not that you shouldn't take medications. There is a time and place, but you do need to be informed. You need to weigh the pros and the cons, the risks and the benefits, okay? So aspirin, specifically baby aspirin. So the number needed to treat, let's go back. So the absolute risk reduction is 0.5%. Well, that's super great. So that calculates into a number needed to treat of 200. So 200 people need to take the medication for 1 year for one person to have a reduction in a cardiovascular event, whether it's a stroke or a heart attack. So the moral of the story, you have to be your own advocate. You have to research. You have to know these terms. Absolute risk reduction, relative risk reduction. So RR, ARR, and the most important, the number needed to treat. That's what you want to know. I'm Dr. Craig Martenson. Be happy, be healthy.